Good morning. You're listening to Slices of Wenatchee. We're excited to bring you a closer look at one of our top stories and other important happenings every Tuesday, Thursday, and Saturday. Today, federal rural health funding could bring big changes for Chelan and Douglas counties, but local hospitals are still waiting to find out just how much they'll get. Before we continue, have you joined Neighbor yet? If not, download the app today and join local conversations about issues that matter. Neighbor is a site just for our local community focused on facts, not misinformation. Best of all, it's free for everyone. To learn more, visit wenatcheeworld.com/NABUR. Now, let's jump in. Washington State will receive $181 million in the first year of a sweeping $50 billion federal initiative aimed at transforming rural health care. The funding, part of the new Rural Health Transformation Program from the Centers for Medicare and Medicaid Services, is intended to strengthen hospitals, clinics, and the wider health infrastructure that serves rural communities across the country. In Washington, 29 of the state's 39 counties are considered rural, home to more than 1 million residents who often face barriers to accessing timely, local care. The state's healthcare authority applied for $200 million, but was awarded $19 million less, prompting agencies to revise budgets ahead of a January 30th federal deadline. Officials say the funding will be spread across several entities, including the Department of Health, the Washington State Hospital Association, both state universities, and programs like Project ECHO and area agencies on aging. The goal, state leaders say, is to modernize how care is delivered in rural communities by expanding the workforce, strengthening partnerships, deploying new technologies, and investing in both efficiency and long-term financial stability. For hospitals like Confluence Health, which covers a vast 12,000 square mile area, including Chelan and Douglas counties, the funding represents a chance to support care where it's needed most. Confluence was part of the state's original application process and says many of the healthcare authority's project goals, including investment in behavioral health and community-based care, align closely with its mission. Confluence says it's closely watching how the funds will ultimately be distributed and plans to apply for what's available. Cascade Medical in Leavenworth, one of 2 critical access hospitals in Chelan County, is also exploring how the program might help expand its services. The hospital already operates a mobile health clinic that reaches Upper Valley residents and partners with local schools to provide behavioral health support. CEO Diane Blake says that while the federal funds won't fully replace the Medicaid dollars lost due to recent cuts, they could still help the hospital expand programs that make a meaningful difference for families in the area. She added that the current impact will likely be modest until more details are available. Lake Chelan Health, the other critical access hospital in the county, is in a similar position. CEO Aaron Edwards says they're eyeing potential investments in telehealth, outpatient specialty services, and facility upgrades. But for now, there's more uncertainty than clarity. The state hopes the program will ultimately support projects that extend beyond the current funding window, which runs through 2030. But until federal authorities review and approve the revised state budget, local hospitals, clinics, and care providers remain in a holding pattern. For more, head over to wenatcheeworld.com. Are you passionate about the issues shaping North Central Washington? Then you won't want to miss the Wenatchee World Forum at Pybus. This monthly event brings together newsmakers and the community to dive into the topics that matter most. It's your chance to engage, ask questions, and be part of the conversation shaping our region's future. Have questions or need more info? Visit wenatcheeworld.com/forum. Now, a few other stories you should know about. Eastmont School Board member Jason Hines is now facing multiple felony charges in Douglas County, on top of the assault and stalking misdemeanors already filed in Chelan County. The new charges include third-degree rape, extortion, witness intimidation, and more, all stemming from a law enforcement investigation that began after Hines' daughter reported abuse at home. Authorities say multiple women, including Hines' former fiancée, corroborated the daughter's claims and described similar abuse dating back years. Hines is scheduled to appear in Douglas County Court on January 20th. Holden Village welcomed back a small caretaker team on New Year's Day as part of a long-term winter safety plan. The remote Lutheran retreat center above Lake Chelan had evacuated most of its staff in December after massive mudslides damaged road access during an atmospheric river storm. Now, 5 staff members have returned by helicopter to begin restoring the village's infrastructure and monitor risks, with more expected to join soon. Officials say visitor access remains off-limits due to ongoing safety concerns. Repair work on Chumstick Highway has been postponed once again due to snow and ice. The highway is serving as the primary detour while a key stretch of U.S. Highway 2 through Tumwater Canyon remains closed. The repairs, which had been scheduled for this week, are now delayed indefinitely until weather allows paving to begin. Meanwhile, speed limits have been lowered on nearby Beaver Valley Road to help manage traffic. Officials say heavy trucks are still restricted from the route, and delays should be expected once repairs resume. The Lake Wenatchee YMCA camp has a new lease on life thanks to a generous donor. Dean Widener, CEO of Widener Apartment Homes, has purchased the 25-acre camp property and is leasing it back to the YMCA for just $10 a year for the next 99 years. The donation also includes a $2 million endowment to help cover future costs. The camp had been on the verge of sale due to rising expenses and declining attendance. Traditional programs will pause in 2026 while a new plan is developed, with faux programming expected to resume in 2027, just in time for the camp's 100th anniversary. Thanks for listening. For more information on all the stories you heard today, visit us at WenatcheeWorld.com. The Wenatchee World has been engaging, informing, and inspiring North Central Washington communities since 1905. We encourage you to subscribe today to keep your heart and mind connected to what matters most in North Central Washington. Thanks for starting your morning with us, and don't forget to subscribe to Slices of Wenatchee wherever you listen to podcasts.